Welcome to Beyond the Stethoscope, where we explore the people, programs, and innovations shaping the future of healthcare across the greater Philadelphia area. My name's Sam Bambino, and I'm your guest host for this episode. Today, we're taking you inside the Interventional Radiology program at Nazareth Hospital, a place where cutting-edge technology meets compassionate care. From minimally invasive procedures to life-changing outcomes, interventional radiology is redefining what's possible in modern medicine. We're joined by radiologist Dr. David Feldstein to talk about the program's impact, the patient experience, and what makes Nazareth a leader in this space. Hi, Dr. Feldstein. Thanks so much for joining us today.
Thanks for having me.
Of course. To start, can you just introduce yourself and talk a little bit about your role as a radiologist?
Sure. So I trained actually in Philadelphia. So I did my training at Hahnemann Hospital. I went to Drexel College of Medicine and Jefferson University. I've been practicing for about 9 years. The majority of the time has been in the Trinity system and at Nazareth Hospital. So I am the section chief of interventional radiology for our group. I'm the chairman of radiology at Nazareth Hospital now. So a lot of leadership roles, which has opened my eyes to a wide variety of experiences.
Great. So for any of our viewers who aren't familiar, what exactly is interventional radiology?
It's a great question. So a lot of people don't know what it is. So interventional radiology is a minimally invasive field that is used to treat a variety of procedures. Unlike traditional radiology, which uses imaging to make a diagnosis, interventional radiology is both diagnostic and therapeutic.
Can you talk a little bit about, is this more of a newer area of medicine? And if not, has it evolved in recent years?
So it's constantly evolving. So it's not really newer, but the fact that it's so dynamic, that procedures are changing so often, is that we can provide more options to our patients, which are minimally invasive.
Sure. Can you talk a little bit about the interventional program specifically at Nazareth? Like what makes it unique?
Sure. So what I truly love about Nazareth Hospital is that it's patient-centered, it's personalized care, and it's a community-focused approach. So we can offer a wide variety of interventional procedures, complex procedures, all minimally invasive in the community setting, which is real close to patients' homes. I like to say our staff, which is some of the best I've ever worked with, they treat patients like their family. So we know a lot about patients more than just the procedure. You know, what they're doing for the holidays, who their grandkids are. We know a lot, and that makes a big difference for patients. So, and then the community setting itself is that since it's convenient and we really take pride in follow-up and outcomes is really important.
Sure. That's awesome. Can you talk a little bit about some of the procedures that you guys do?
Sure. So interventional radiology is a wide variety of procedures. So everything from cosmetic vein treatments, like treating spider veins or varicose veins in your legs, all the way up to spine procedures, like treating back fractures, or interventional oncology, treating liver tumors, cancers. We remove blood clots from the lungs, from the legs. We treat infections. So we work with a wide variety of referring doctors, which keeps it exciting.
Can you talk a little bit about what maybe a typical patient's journey looks like from referral all the way up until recovery?
Sure. So we get referrals from primary care doctors and also other specialists. So I will get the patient's name and review all the patient's chart. I'll review all their imaging. I'll bring them in for a consult, and then I will go over the possible procedure to see if that's the right procedure for them. Mm-hmm. Then afterward, if they do proceed, we'll bring them in. Procedures typically same day. Some patients are admitted overnight for a short hospital observation. Mm-hmm. We use either local numbing medication or just a moderate sedation through the IV. They go home the same day typically.
You mentioned that the field is constantly evolving. Can you talk about any just maybe new technology or anything at Nazareth within the past couple of years?
Sure. So the field is evolving in many ways. So we have improved navigational systems to get to our target. We have improved devices, catheters, wires, resolvable devices and stents that we can put into the body that are drug-eluting, which allows us to provide the best care that's available.
Can you talk about how interventional radiology compared to maybe traditional surgery improves patient outcomes and just recovery times?
Absolutely. We have a great relationship with our surgeons, but if we can offer a less invasive approach, that's what we would prefer. So A lot of procedures are no incisions or very small incisions, which causes minimal disruption to the body. With that being said, the outcomes are better, sometimes depending on the procedure. There's less recovery time. There's sometimes be a less cost to the patient, and sometimes less pain involved as well.
That's what one can ask for.
Yeah, true.
Yeah. You mentioned before that, the interventional team really gets to know the patients, what they're doing for the holidays. Is there anything else you can talk about as far as how you guys just interact with the community, maybe especially the underserved?
Absolutely. So that is a big component of what we do in the area we're in. So community outreach, education, that's the biggest part, just to screen patients, let them know what we can offer. Because again, a lot of patients don't know the field of interventional radiology and what is out there for them. And they may have been told by other specialists that they can't get a procedure because their heart may not be strong enough or it's too invasive for them, but we can offer them an option that actually improves their quality of life.
Do you find that there needs to be maybe more awareness that interventional radiology exists? And is there anything that you would want the community to know about it?
Absolutely. I think we're constantly, doing education sessions, doing outreach, doing different screenings. But more importantly, if there's any question at all, just reach out to your primary doctor and let them know if there's any less invasive options out there. Again, we have some patients we have actually walk in and find us on the internet or on a website and want a procedure and just come to talk to us about it. Mm-hmm. Yeah.
Great. Was there anything else you wanted to add in about the topic?
Again, I think just the field itself is ever changing and evolving. I think it's very dynamic. I think which is really neat is that we're at the stage where we can even treat joint pain through a tiny incision in the wrist or the groin. Wow. So in some patients who can't have a knee replacement, for example, or if they do have a knee replacement, they're in pain, we can actually go in, find the blood vessels that are causing the problem and treat the blood vessels and take away their joint pain. So again, there's so many options and it's hard to keep up to date on everything. I think patients, as long as they educate themselves and, just search on the internet, unfortunately, I hate to say it, but sometimes it's the best way to at least get you to where you need to go and we take it from there.
Sure. Yeah. And one last question. You mentioned joint pain. Are there any other conditions that you can treat through interventional radiology that maybe someone might not expect?
Sure. So we can treat fibroids. So uterine fibroids is a huge one for females typically in their 40s. Again, minimally invasive, not a lot of recovery time. So a lot of these patients, they have children or they're working and they don't have the ability to be off work for a couple weeks to get a hysterectomy. So this allows them a quick recovery time and get back to life. Mm-hmm. Again, we treat varicose veins in the legs. We put in chest ports for cancer. We do all different types of biopsies throughout the body. We remove blood clots in the lungs. We treat venous disease, real swollen legs and leg swelling. Yeah.
Very interesting. Well, thank you so much for being here today. We appreciate it.
Sure. Thanks for having me.
Of course. From precision procedures to compassionate care, it's clear that interventional radiology is changing lives, one minimally invasive step at a time. If today's conversation sparked your curiosity, whether you're a patient exploring options or a professional looking to innovate, we encourage you to dig deeper. The future of healthcare is happening now, and it's happening here. Learn more at the link in the description below. Thanks for tuning in to Beyond the Stethoscope. Don't forget to subscribe and follow Trinity Health Mid-Atlantic on social media for new episodes every other Thursday.